pharmacy before I leave. Quickly nip in. I get them in pharmacy here, don't I? Those. Yeah, that's what I thought.
You know where you're going.
Yeah. Yeah, I've been here before and stuff, so.
Right, I'll stand over here, so I'm out of your way.
Yeah.
I don't want to get in your way.
Well, at least it's not red, because the redness was right up to my knee. It was my whole foot, right, travelling up. And my mum said, I don't like the sound of that, get up A&E there. But it's,
I put the bag on the wrong side, haven't I? Put it the opposite side to start it. I'll wipe around the wound to start with.
okay, yeah. Yeah, that don't hurt at all, actually. That's quite nice. No, yeah.
That's refreshing.
It is. Yeah, yeah. I was stood on a chair, like a sofa chair, trying to get up to the corner shelves to dust them. There was this round coffee table in the way. I came down, slipped. Sort of, I don't know if I blacked out, but I don't remember. And I took a chunk out of my leg on a round coffee table. Like for 3 weeks, I thought it was fine. It scabbed up, it looked okay, and then I woke up at 5 o'clock one morning and pus was running down my leg. So I went straight to the doctor and he put me on antibiotics, which were the wrong ones. And I was on them for about a month, doing nothing, and the nurse was trying to clean it and it was just getting worse and worse and worse. And in the end I had to go to the doctor's just over a week ago and he went, enough's enough. It's not working.
I was keeping it clean with salt water, and as soon as the nurse told me to stop doing that and leave the wound alone because you're aggravating it, it got worse within days.
Because all the nurse would do was just,
They are,
all she was doing was just sticking manuka honey in it and putting a bandage, a sticky plaster over it, and then giving us some and telling us to do it every other day.
Yeah.
You know, it was mad.
But I wasn't allowed to clean it.
No.
Which is really strange, you know. You put all that manuka honey in, and then you're not allowed to wipe all the stuff off the outside of the leg where it's oozed out. You just put more in and put a patch over it. Didn't sound right to me. And the salt water was doing so good because it was keeping it was clean.
I know, I was just looking at that. Is that a stitch?
That's what I was wondering.
Oh yeah, I see what you mean.
Got rid of the forceps. Can you grab me some forceps?
Because I don't know whether it's a dye or it's still got something in there, but...
It's in 2 areas, isn't it?
Yeah. Oh dear.
I'll see if it comes away easy. I'll pull it out.
Okie doke. Yeah.
No.
But then if you kept it in there, would that cause more infection?
Probably, yeah.
It'd be better to get it out, you know, while it's like this.
Yeah.
And then you start healing.
That's right. But I have got a very low immune system, I must admit.
Is it a stitch?
It looks like it to me, it feels like it. Yeah, it is.
Yeah, it's moving about.
It's moving.
I'm glad I spotted that.
Yeah. There's one right opposite it as well, on the left there.
Yeah, there's one there.
You see that one?
How did you miss that on the outside? Because it wasn't on the outside, was it?
No.
It's tucked under, and because it's got...
That's not part of the original stitch that you cut out first time round.
Which one do you mean?
Yeah,
The one that you just pulled, not the one you got out of now, the other one.
It must be part of...
That's a separate stitch, that is. What's that holding it?
That's the end of it, that's coming up through, and then you've got the bit there, which looks like that from here, is what it looks like when you're on this side.
I reckon you need to go and call him.
Who done the operation? Do you remember?
Oh, I don't know. I know he was. He saw me in A&E, and I did see. Is it the first stop when I had the back?
See what I mean?
can't
You
remember.
cut it.
Yeah.
It's like it's.
Yeah, you can see the skin move, can't you?
Yeah.
What's this one here? Let's have a look, sorry.
Yeah. Okay.
Have a look again.
Hold on a minute. Might not be open.
That's
I would have done when he got in.
As I cleaned it,
Yeah.
it's a stitch, yeah.
Okay, we'll just take that one out. I think they're
But
probably
we
trying.
can't work out where it's sort of connected to.
It's fine. Just cut it. Oh, yeah, just cut it out. It's probably it's a dissolvable stitch, and it's in there to sort of try and hold some of this together. So
Right, okay.
the bit that you can see, I cut, but I just leave the rest and just clean it a little bit,
Yeah.
maybe, and then put that packing in, and it should be fine.
Okay.
So we'll
Right.
keep an eye on it.
Yeah. Yeah.
Yeah.
So I've written a letter to GP anyway, but we'll see in a week's time. We'll continue the antibiotics for a week, and
Mhm.
we'll have a look again.
Okay.
What I might ask is that if your GP can see a district nurse
Yeah.
in 3
Okay.
days' time between
Yeah.
now and when we next see you.
Okay.
Okay.
Alright.
Yeah.
Yeah. Trying,
Cash?
trying to get a GP appointment. It's like rocking on shit.
The nurse you should be able to see.
Yeah. Even that's a problem.
Oh, is it?
Yeah.
Just go get some.
Okay.
It's getting wider and wider, isn't it?
Mhm. Yeah.
That looks more horrible now than when it was round and full of pus.
Mm.
Because you've actually got some interior that you can see,
Yeah.
whereas before it was just yellow.
Yeah. With passing and motor. Oh yeah, the blood test yesterday. I was a bit stressed. I wonder how that was because my white cell count was slightly up on 5 in the hospital when I'd done a blood test, and I had to have another one yesterday. Didn't I?
You did. So I wonder if your cells are up or down.
Yeah. I could ring the surgery and find out the results.
Yeah. I mean, that was a really nasty injury you had.
Yeah.
It doesn't really surprise me that you're having problems,
Mm.
to be honest.
Yeah.
Let's get out the lady's light. There's a light on there. How's that?
Oh, yeah, that's. See now, no? See, these will just dissolve any
It's like that stitch goes round in a circle.
Yeah, but it doesn't want to pull out. You'd think it would pull out if it went round. I don't think it's going to come out, is it?
There was me thinking this was going to be easy.
Yeah. Oh, another one. Or is that the same one?
Yeah, that's part of the
Oh,
same
that's
one,
the
isn't
same
it?
one, isn't it?
You're okay, you're not hurting me.
Ah, it's coming out that bigger.
Oh, brilliant.
That's it.
That
It's
was
got him.
better, wasn't it?
Yeah. Because I kept looking at it thinking, what's that blue? It can only be stitches.
Yeah.
Yeah. They don't do any harm, those stitches, in all honesty. They will just work their way out
Would they?
themselves.
Yeah.
They wouldn't.
It's just I've had so much infection. I did
Yeah,
this
you
in
did
July
that
the
as well.
6th, and it's like,
Yeah.
it's one thing after another, you know. I just want to heal and get better. I feel better than I did. I had such a fever.
So what we're going to do is we're going to just place it in.
Okay.
Is that not hurting?
No.
Have you got no nerve endings left in your leg or something then?
No, I can feel slightly, but it's nothing to scream about or anything like that.
Well, you have got a high pain
I need it
threshold.
thinner than that actually. A little bit thinner than that. 'Cause we didn't want it too much. I don't want to like, because if we force too much in there, it's going to open the wound up.
Yeah.
See what I mean? So we don't want to do that. You alright?
Did you call me?
I did earlier. Don't matter. I've done it now.
No, literally just now.
Oh no! I thought somebody said your name as well.
She in the appointment at 10 o'clock.
Just like that.
Yeah.
Okay. Make sure it's under the top bit there. You can use the forceps actually just to push it down a little bit. Cleaned it all out and then there were stitches inside. Oh, were they not dissolved yet?
No.
Yes. Somebody said take a bit longer. So
They were quite big stitches.
They,
were pretty long.
they got to close the muscle up, you see. So they use different layers of stitches.
Yeah.
So you have the muscle layer and then you have the skin layer on top.
Oh, I
so
see.
that's why you have different stitches.
I see.
Yeah, you don't really think about it, do you?
You don't. You just think stitch is a stitch.
Yeah.
And that's it.
Cool.
Thank you, Flower. Nice bit of info there.
Yeah.
She's very clever, Siobhan.
Mm.
You got to be to be a nurse. It's no good forgetting everything you've learned and then go to work, is it? It's,
No.
it's a bit of a disaster, that'd be.
Yeah.
And it's definitely one of the jobs you learn on the job.
Yeah.
You know,
Yeah.
no matter how much you do in the classroom.
That's it. Yeah.
I'm just going to put on an opposite dressing on. So it's very similar to the one you had on before.
Yeah, okay. Got a good bit of padding on that. So.
Yeah.
Yeah, and it hasn't got floppy, sticky around the outside. Some of them, I hate them. They crease up and all sorts. They're terrible.
No, this one is sticky around the outside though, so I'm not sure if that is a clear one.
No, but I mean, when you put them on, the
Oh, I
actual
see what
sticky
you mean.
themselves
Yeah.
is so...
Or when it all creases. And
Yeah, it's such a nightmare.
There you go.
Thank you.
What I'll do
That
is
was
I'll get a
lovely.
letter for the practice nurse.
Okay.
Put in an envelope and pop in what we've used.
Yeah.
So when they do it themselves, they know
Yeah.
exactly what we've used and they can use the things.
Okay, all right.
We know about next week. We know if it's working.
Yeah.
We know we've done the right thing now, wouldn't we?
Will you just send me an appointment through the post again?
You can book it today.
Oh, can I?
Desk
Oh,
and I'll
okay.
book the appointment for you.
Okay, so I'll book it for next Tuesday. Are we Tuesday today? Yes.
We
Yeah,
are.
we are. Sort of lost the days
Yeah.
since I've been in hospital.
Next Tuesday it's fine.
All day. Well, thank you for allowing me to record. I appreciate that, Flower. Some people get a little bit funny being on camera,
Yeah.
but you don't seem to mind it.
No.
Right.
Yeah, it wouldn't bother me actually.
We need more nurses and doctors with an attitude like you, and then we can all video. Right, I'm...
Put the bedtime before you get off then.
Yes, please. I don't want to fall off and break my leg or something stupid. That's all I need. So no showering, just strip wash. Try and get all this pink stuff off my leg as well. Yeah, horrible stuff.